Welcome to the Get Well Now podcast. We talk about healing the body, mind, and spirit with nutrition, herbs, and natural medicines, which complement Western medical practices. I'm your host, Andrew Gettert, and today we're talking about transgender care and hormonal health. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week. When asked to do this presentation, I had to think about it. Although I'm not an expert in transgender care, I am an expert in herbs and hormonal health. So basically, transgender clients today, as well as pretty much all of my menopausal clients, have really wondered, are there plant estrogens or phytoestrogens that mimic estrogen, or are they herbal compounds that have testosterone or help reduce testosterone? So I'm going to answer that question in a little bit. Right now, I just want to talk about transgender care in general. So in general, people with transgender people that are transgender have problems with healthcare access, and they feel like many of us feel during COVID-19, alone, isolated, and disrespected by the medical profession. And as a young man, when I was 19, almost dying of Crohn's disease, I felt the same way, alone, isolated, and disrespected by the medical profession. Now, the good news is that there are natural practitioners who specialize in transgender care. And I've been in touch with two of them, two acupuncturists, one in Oregon, one in California, who basically are a resource to their community. And I wanted to interview them, but they weren't available. And one of the transgender acupuncturists in Oregon, I don't believe is actually practicing acupuncture. So this is all about saying that I think that if you find that you're disrespected with standard medicine, if possible, you might want to check out natural medicine. And the real difference is that Western medicine or standard medicine really treats the disease and the symptoms. So even if you have cancer, they're treating the symptoms. They're not really treating your body. So this is why natural medicine is so powerful, is that it treats the person with the symptoms. So it's a more tailored, personalized approach. And so that's why it's particularly suited for people that have difficult to treat conditions, health conditions like long COVID, autoimmune disease, and transgender issues. So it's very, very important for transgender people to find a sympathetic doctor and health professionals. So let's talk about hormonal therapy. So hormonal therapy is used to make a transgender person more masculine or feminine. And hormones, synthetic hormones, have their risk. So testosterone can damage the liver, and this is especially true if it's taken in high dosages or by mouth. And so now estrogen, on the other hand, can increase blood pressure, can increase blood sugar levels, can induce blood clotting, and anti-estrogens, which are used along with estrogens, can lower blood pressure, disturb electrolytes, and dehydrate the body. And so hormonal use should always be supervised by a doctor. So the main questions that I get asked by transgender people are there natural approaches to synthetic hormones? And then the other thing that I get asked is, can you mitigate some of the damage that the synthetic hormones cause? And so, for instance, many of these estrogens and testosterone really are hard on the liver. In addition, alcohol and recreational drugs are also hard on the liver. So people that feel like they're toxic can do well with liver herbs. And one of my favorite liver herbs is actually milk thistle. In the case of estrogen and dehydration and blood sugar imbalances and blood sugar, again, these are symptoms that are best using an integrative doctor or a naturopath who really knows how to manage these conditions naturally can be very, very useful. And so now this is something that I recently learned. So trans men who still have a uterus, ovaries, or breasts are at risk for cancer in those organs. And so natural practitioners can help steer you in the area of preventive therapy to reduce cancer risk. Now, trans women are at risk for prostate cancer, although this risk is low. So basically, you want to think about in my experience, the lowest possible effective dose of synthetic hormones, and then consider augmenting with natural therapies. Now, transgender people have a higher risk of depression and anxiety. And part of this due to being disrespected by the medical profession and also difficult getting support with friends and family members sometimes. And so transgender people also have increased risk of suicide. So people that are struggling with these issues, I really recommend counseling, therapy. In many ways, therapy works better than medication, although these days, Western medical health professionals are very quick to, reach out for that prescription pad. And, my concern is that in the case of antidepressants, we do not know how antidepressants work or if they work at all. This is the SSRI antidepressants like Prozac. Okay, so depression, anxiety, it's really good to think about finding a counselor, but what naturopaths and integrative physicians and acupuncturists that prescribe herbs can offer, again, is a customized approach. So a transgender person may have various issues, including depression, anxiety, substance abuse, and may have some Western heart issues, while a practitioner can address all those. You don't need to go to a liver specialist. You don't need to go to a physical medical doctor as long as with two other doctors. It can all be in one house. The naturopath or integrative physician can organize that more complete treatment, because there are many causes of depression, anxiety. And what you might not know is that integrative practitioners have tools at their disposal that regular doctors don't. One of this is light therapies. So cold laser and light boxes can be very effective for reducing seasonal depression, regular depression, and also can help with anxiety. Also, there are nutrient combinations that can be used orally and by IV, which help people with anxiety and depression, whether they're transgender or heterosexual or gay. And then the last thing I kind of wanted to talk about is, so there's integrative physicians offer more complete treatment. They offer different treatment as well. So I wanted to mention that you might get help that way. So now I want to get to two of my transgender clients, Nikki and Sam. So Nikki came to me because she was spending hundreds of dollars a month on hormonal supplements. And after 6 months, she came to me and she said, I'm not getting anywhere. I'd hoped for, changing my fat ratios and less abdominal fat and more hip fat. I'm looking at trying to have some breast development. I'm looking, and I'm not seeing any of that. The only thing I've seen, hundreds of dollars a month, 6 months, the only thing I've seen is my skin's a little softer. Is that typical, or do you have better herbs? And they said, unfortunately, Nikki, this is my experience, that phytoestrogens may be effective in menopause, but they're, plant estrogens or nutritional supplements are just not effective at making the body more masculine or more feminine. So that's my experience. And so Nikki ended up going for synthetic hormones because she was interested in the results. And what she did is she used natural medicines to mitigate or reduce the danger of those synthetic hormones. Now, the next client, Sam, came to me because Sam was already taking heavy dosages of libido enhancing herbs. I think Sam was taking like 9 or 12 capsules a day. And so these are things like maca and I believe deer antler, all sorts of things like that. And so he said to me, like, I find if I take large doses of these libido and testosterone supporting herbs, I can reduce, but I cannot eliminate synthetic testosterone. And I said, that's exactly my experience, that herbs and nutritional supplements can potentiate hormonal treatments, but they can't replace them totally. And so basically, Sam it continued on 9 to 12 capsules of libido enhancing herbs, which have an effect on potentiating testosterone in the body. But then to get the results, he also used a low dose of synthetic testosterone. So the take-home messages for today is herbs may potentiate or augment estrogen and testosterone, but not replace it. Be very wary of people peddling transition herbs or natural transition treatments. They can be expensive and they can be non-effective. So remember, Nikki spent hundreds of dollars a month and got no results. And then third, please consult with a health professional about suggestions made in this podcast. This concludes our podcast for today. If you enjoyed this video and found it helpful, please be sure to like and subscribe to our channel for more videos like this one, and be sure to hit the alert button to be notified of new videos each week. For more information, please visit us at getwellfoundation.org.